I am Barvetta Singletary, the Policy Director for the Office of the Majority Whip. And I'd like to thank the Congressional Black Caucus Institute for inviting me to serve on this distinguished panel this morning. Bill Kirk, Angela Reamer, who are in the audience, who I have the privilege of working with. Thank you so much to both Representative Scott and Representative Christensen, who I worked with as we toiled to get the Patient Care and Affordable Act passed. If you recall, this time last year, all you would see on the news were people screaming at the members of Congress as they debated this bill and what it would mean for this country. And the news reports would lead you to believe that the day after the act was passed, that somehow this country was going to falter. And the day after we passed the bill, I looked around and I said, wow, we're all still here. What I'd like to do is just give you a brief overview of some of the more pertinent provisions that are included in the Affordable Care Act, some of which you may know, some of which you may not. So let's start talking about Medicare. I know seniors have been concerned about the various provisions in the bill and what it means to them. And as I said, reports would have you believe that we were going to have, dare I say it, death panels, and we were taking away people's health care at the expense, providing individuals health care and access to health care at the expense of seniors. What I'm proud to say is, through the provisions that we provided in the bill, the Medicare Trust Fund is going to be solvent for more than 27 years previous to what it would have been when we passed the legislation. But if you're a senior on Medicare, what this bill provides you is free preventative care. Now, one of the struggles that we had while debating this provision was getting the Congressional Budget Office to score the bill. When I say score, that means putting a price tag on it. And the argument we were trying to make to them was that if you give persons an opportunity to have access to coverage and access to care before they get sick, then you will end up catching the diseases at an early stage, preventing certain diseases, and that in itself would be a savings. Well, the CBO came back to us and said, yeah, well, it may be a savings on the front end, but people tend to live longer when you give them access to preventative care, and so therefore it's going to cost you more in the long end. We threw up our hands and said, okay, well, you know, we're not going to agree, but because they are the official scorekeepers, we had to abide by that assessment. So no co-payments and deductibles for seniors when they go to access preventative care. Also with seniors, you may have heard about what's called the donut hole. The donut hole is that gap in coverage when they go to access prescription drugs. And Angela, Pharma, you guys have been great friends of ours. Once you reach 2830, I think it is, for plan year 2010, you have to end up paying all costs that you incur for prescription drugs up until you reach $4,550. For the fiscal year 2010 year, what we did was provide a $250 rebate for seniors who fall into that coverage gap known as the donut hole. And what we did in the law was to, over the next years until 2020, eventually close that donut hole so individuals would not have to come out of their pocket to access prescription drugs. Also, starting next year for seniors and Medicare, along the same lines of the prescription drug coverage, our great friends at Pharma will provide a 50% discount to brand name drugs when they go to access prescriptions in the bill. One of the more popular provisions was extending coverage to young adults until their 27th birthday. I will not tell you how much of a response, positive response, we have gotten when we've talked to audiences and people find out. I'll tell you a little story about one of our first town hall meetings with Congressman Clyburn in South Carolina. There was a young lady that stood and said that she was pursuing a pre-med degree. She was entering into, I think, her first year of med school, 23 years old, and found herself without insurance. And she wanted to know why was it not possible to stay on her parents' insurance until she got on her feet, finished school. And after that meeting, Congressman Clyburn at the web, he brought it to the attention of leadership and said, look, this is something we really need to take a look at. If parents want to keep their children on their insurance, they should be allowed to do so, contrary to what many people may think. We're not forcing parents to do that, but if they choose to do that, individuals up to their 27th birthday will have the opportunity to stay on their parents' insurance. What the bill also does, it has a ban on pre-existing conditions. Your family or friend, you may know someone who has diabetes or heart disease, or I'll tell you how bad it was. I'll give you an example. An individual named, I'll call her Susan. She came to me as we were drafting this bill, and she said that she and her husband wanted to have children. They were covered by their employer for insurance. However, the coverage did not provide fertility services. So they went out, took a loan, and paid for it out of their pocket. Well, when Susan's husband switched jobs and it came time to do his application for insurance, Susan was denied, as was her husband. And the reason was she had a pre-existing condition of infertility, and he was denied based on spousal infertility. Now, think about it. They went out and paid to conceive a child, which the insurance did not cover. But then when they went back to get covered at his new job, they used that same reason that they went out, took that loan to conceive against them. And countless situations we have encountered similar to that, even infants born with juvenile diabetes being denied coverage because of a pre-existing condition. Well, in this law, we said, no, you are not allowed to deny anyone coverage based on a condition that they may have had previously. What we also do in the immediate term is ban insurance from putting a cap on your lifetime benefits. I'm sorry about using these anecdotal stories, but ran into a young woman whose child had been diagnosed with cancer. And they had reached, by the third, fourth treatment, they had reached the lifetime ban on their service. So